if you don't have health insurance and you're unable to see a physician, whether that is a gastroenterologist or a colorectal surgeon or other specialist, it can be incredibly difficult to even have access to some of the medications that treat these diseases. Um, a lot of times, some of us cannot frequently attend doctor's appointments and those sorts of things because whether that's a large deductible or the lack of specialists nearby in our area, those sorts of things can become problematic and certainly expensive. So I think one thing I have learned a lot about and have done a lot of advocating for is making your appointments, whether you have one appointment a year or one every 6 months. It's really important to utilize that time. And I always tell patients, if you can walk in there with even a list of like 3 bullet points that you need to cover during that time, during that appointment, it can be incredibly beneficial and efficient to get some of the answers that you need in order to move forward without being charged for another office visit. And I think a lot, especially, if you have been diagnosed, your doctor is going to start you on some sort of treatment regimen. And I think asking questions about copay assistance programs or payment programs, or there are a lot of different medication programs that are out there that not only educate patients and hope to make their drugs more accessible for those who need them, but will also help navigate and kind of troubleshoot a lot of the things to do with payment and whether or not your insurance covers the drug and those sorts of things. And the other thing that a doctor can do to bring down the cost of a drug is to send in prior authorizations to have a drug covered, or if the drug is not covered, your doctor always has access to things like payment programs and copay cards and those sorts of things. So I think those are important questions to ask. And depending on what area you are in, there's quite a few places, especially if your doctor suggests a drug, like let's say they suggest Remicade, you can literally Google Remicade and contact a representative from there who should be able to help you troubleshoot and, of course, fill out some of that paperwork regarding payment and accessibility and those sorts of things. So there's a lot of resources out there to help. I wouldn't say I'm an expert in this area at all, but there is information and there are resources out there.